So, hello sir, this is my patient today, Danilo Shanda. Good afternoon sir, my name is Dwayne K. Francelas, a student nurse from BSMLG, and today I will be performing the assessment of the abdomen. So, the only equipment needed is a stethoscope. So, procedure number 1 is assess the client's physical and psychological aspects before and during the examination. This allows the healthcare provider to gather complete data about the client's health history or health status. So, good afternoon, sir. My name is Winter Francelas, and may I know what your name is?
I am Danilo Di Shanda.
Do you feel any pain po, sir, physically and mentally?
Yes po, may natin ako. Nakaka-irritate po yung sakit ko. Minsan kapag ito yung makakit.
So, the patient is irritated with the abdominal pain that he's currently experiencing. So, meron po siyang pain, sir. So, procedure number 2 is review the body areas to be examined. This helps the healthcare examiner to identify which parts of the body are to be assessed or examined systematically. So, the body areas to be examined here are the abdominal area. So, dito po na part ng patient, sir. Procedure number 3 is make a physical and environmental preparation before the examination. Proper preparation of the environment, client, and equipment ensures smooth physical examination with little interruptions. So, here in this room is quiet and provides privacy po from the outside world. Procedure number 4 is gather and take the health history of your client. This is to have a comparison with the client's previous illnesses to his or her present health condition. So, sir, does your family ever have a history of abdominal pain or sakit sa particularly sa tiyan?
Yes po, nurse. So, last time my mother was diagnosed of gallstone in her, gallstone. But I have also experiencing right now the abdominal pain.
So, sa mother niya po, sir, merong gallstones and currently is experiencing abdominal pain. So, procedure number 5, i-take mo po yun and pang-compare. So, procedure number 5 is conduct a physical assessment of the abdomen using the 5 skills, well, 4, pero merong 5 na, of assessment: inspection, palpation, percussion, auscultation, and olfaction. This is to assess, determine, and identify abnormal findings in the abdomen. And the other is auscultation should be ahead of percussion and palpation in order to properly hear the abdominal sounds. So, this is yung extra dito po. So, proceeding sa procedure number 6 is inspection of the abdomen. So, we're going to inspect the abdomen. So, inspect the abdomen for skin integrity. Normal findings here should be unblemished skin, and the skin of the abdomen should be uniform in color. And abnormal findings is presence of rashes or other lesions, tense, glistening skin, may indicate ascites or presence of edema. So, okay. So, sir, excuse me po, sir. So, I will be going to inspect or begin my assessment. So, okay. Pwede ko po i-move ang shirt niyo. Ito mga dapat, sir. So, wala naman pong rashes yung client, sir. Pero, meron siya mga kagat ng mga mosquitoes.
Ano ba?
Langgam po kasi. So, yun. Yung mga marking sa kanyang abdominal area. So, procedure number 7 is inspect the abdomen for contour and symmetry. Ask the client to take a deep breath and hold it. If dissension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. So, normal findings here are flat, rounded, convex, or scaphoid. No evidence of enlargement of the liver and the spine. So, the spleen. So, the liver is in this area and the spleen is in this area below the left nipple. And the last one is the last normal findings here is symmetric contour. So, wala pong asymmetry ang tiyan ng ating patient. So, the abnormal findings are this descended evidence of enlargement of liver or spleen, and the last one is asymmetric contour. So, excuse me, sir. I'll now be going to assessing your abdominal area then. Pero, sir, can you follow my instructions?
Yes po.
Okay, sir. So, I want you to take deep breaths, bro. So, breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. So, wala akong na-note na asymmetry sa abdomen ng patient while taking a breath, and hindi po distended ang kanyang liver and spleen, and also in good shape po yung kanyang abdomen, so wala man pong masses na na-detect. So, proceeding to procedure number 8 is observe abdominal movements associated with respiration, peristalsis, or aortic pulsations. So, normal findings here are symmetric movements caused by respiration, and the abnormal findings here are limited movement due to pain or disease process. So, sir, so, excuse me po. So, yeah, I will observe your stomach again or your abdominal area for any abnormalities po. So, sir, breathe in, breathe out also. Wala naman pong abnormal movement sa abdominal area ng aking client, sir. So, I note po normal findings po, sir. So, procedure number 10 is observe the vascular pattern. Ideally, there should be no vascular pattern, and abnormal findings is dilated veins. So, normally, sir, dapat wala kang ugat na makita dito, pero pag meron, abnormal po. So, observe lang po. Excuse me po, sir. So, no veins are present po, sir. So, I note normal findings po. So, sunod, the next is auscultation of the abdomen. Procedure number 11 is warm the hands and and the stethoscope diaphragms to auscultate the abdomen. So the rationale for this is cold hands. Cold hands and a cold stethoscope may cause the client to contract the abdominal muscles. So normally, sir, like if we are cold, na constrict talaga yung muscles natin, like it's a natural response po sa temperature. So, one. So moving on to procedure number 12 is ask what the client last ate, and the rationale for this is procedure number 12 is ask what the client last ate, and shortly after or long after eating, bowel sounds may normally increase. So, I think, sir, this is due to the digestion process sa chan, kaya na-increase po yung sounds. So, procedure number 13 is place the diaphragm of the stethoscope in each of the 4 quadrants of the abdomen. So, the 4 quadrants are the upper right quadrant, the lower right quadrant, the upper left quadrant, and the lower left quadrant. So, rationale is to assess all the areas of the abdomen, so para complete yung process. So, excuse me, sir. So, I'm going to auscultate na po. So, procedure number 13. Procedure number 14 is listen for any active bowel sounds. So, normal sounds is audible bowel sounds consist of clicks and gargles, and 5 to 30 per minute occasional verborygmus may be heard. So, and abnormal findings are hyperactive bowel sounds and hypoactive bowel sounds. So, hyperactive bowel sounds is hyper masyado, and hypoactive like very decreased po yung sounds ng narinig mo. So, those are the abnormal findings. So, excuse me, sir. So, moving on to percussion of the abdomen. So, percuss areas in each of the 4 quadrants of the abdomen. So, the abnormal findings for this is tympany over the stomach and gas-filled bowels or dullness. That's the normal findings. So, abnormal findings is dull or wala agad marinig, which means that the stomach is probably, or the abdominal area, or merong tenderness or may problems po. So, excuse me sir, I'm going to percuss your abdomen po. So, will you allow me to? Excuse me sir. Excuse me sir. So, excuse me po sir. So, sir, can you move to your side po? So, ang nakalagay po sa video, sir, is wait for 30 seconds bago po i-percuss ulit yung dito na side po ng quadrant ng patient natin para po mabigyan po ng rest. So, wait po tayo 30 seconds. So, gusto ko sir. So, so, meron pong tympanic sound sir, tapos hindi po dull ang pag-percuss ko sa stomach ng patient or sa abdomen ng patient, which means na hindi po siya tender and normal po ang findings according po sa checklist. So, procedure number 16 is palpation of the abdomen. So, 16 is warm the hands and perform light palpation first to detect areas of tenderness and or muscle guarding. So, the reason for this is cold hands can elicit muscle tension and thus impede palpatory evaluation. So ideally, there is no tenderness, relaxed abdomen with smooth, consistent tension. And abnormal findings is there is tenderness and hypersensitivity. You can detect superficial masses. And the last one is localized areas of increased tension. So may tension po sa abdomen niya. Those are the abnormal findings. So, sir, excuse me po, sir, can you lie down straight po? So, sir, lie down straight po. Excuse me po. So, I am going to palpate your abdominal area, sir. So, excuse me po. So, consistent consistent po siya sir ang tension. Smooth, consistent po ang tension. No superficial masses detected or walang tenderness ang detect. So, then is perform deep palpation to detect areas of tenderness or muscle guarding. So, ideally is same kanina sa procedure number 16. So, no tenderness, relaxed abdomen with smooth and consistent tension. Ideally, no tenderness and hypersensitivity. Ang abnormal findings is there is tenderness and hypersensitivity, superficial masses are detected, and localized areas of tension, localized areas of increased tension. So, same na po ang 16 and 17. So, sir, excuse me, sir, I will be palpating your abdomen again, pero this time deeply lang. So, sabi ko lang po sir, masakit pa. So, I indicate normal findings po, sir. So, smooth and consistent po yung tension and wala pa akong may na-detect na superficial masses. And also, no tension po ang nakuha ko, ang detect and no tenderness. So, proceeding to procedure number 18 is palpate the bladder. Palpate the bladder above the symphysis pubis. This is to detect urine retention. So normal findings is it's not palpable and there is no dissension. Abnormal findings is it is palpable and descended. So, excuse me sir, I will be going to assess your bladder po sir. So, excuse me po. So, hindi mo po mapalpate yung bladder, sir. And hindi po siya descended or hindi po siya visible kahit like hindi pa masyado exposed yung symphysis pubis area. So, I indicate normal findings po. So, procedure number 19 is moving on to evaluation. Make findings of health assessment and physical examination done on the client. The rationale for this is these are important data used to convey to the physician to aid in the diagnosis of the patient. So, sir, okay lang po ba kayo? Ano po ang, okay lang po ba? Wala man pong danger in the procedure po? So, medyo masakit po ba ang areas na examine natin or wala? Siguro po sir, may nakain lang po kayo na siguro baka may baka ilang araw na nakalipas nun tapos nagulot na po pala yung kain. So, advice ko lang po sir is magpa-check lang po kayo ulit sa doctor and just to be sure po sir na accurate po yung findings here. And also wala man po kami na-detect na any masses or any problems talaga or any tenderness or tension sa inyong abdominal area. So, okay lang po ba sir? Okay lang po sir. So, the next is documentation. document and report any pertinent findings found during the assessment to appropriate personnel. And the rationale for this is to provide accurate data in the care of your or the client. So, kaya po sir.